Now we'll begin a round of 5-minute questions. Dr. Wergen, it seems, well, about half the doctors, half the physicians who are participating in Medicare and are eligible for the electronic health records program aren't participating. And they're about to be penalized this year. Why are they not participating? And why are they willing to accept a penalty rather than participate?
Well, Senator Alexander, that's a good question, and a lot of it has to do with the regulatory requirements to meet meaningful use. And I'll use a personal story again. I met meaningful use on the last day of the 90-day reporting period when my staff came up at 3 o'clock. The reporting period was going to end at 5 and said, "You're 2 patients short of having a patient send you a question through the portal." I stopped what I was doing, called 2 patients that I'd seen. "Could you send me a question about your labs?" They were a little confused, and I met it by the skin of my teeth. The all or nothing quality of that, those 2 patients allowed me to participate in meaningful use and avoid the penalties. If they had not, I would not have met meaningful use and got the penalty. All or nothing, 100% or 0%. So many of the providers, in terms of their workflow and the reporting requirements, particularly small practices, I don't have an IT support team. My staff and I worked very hard on this, spent many hours, and in fact, if I'd have calculated the hours I spent on meaningful use, it may have been a wash in terms of the benefit, but also the penalty. So many practices, as they look at it, say, we're engaged, we were early adopters, about 77% have electronic health records, say the time, expense, and the effort it takes makes it not worthwhile, and I'll have to take the penalty.
Mm-hmm. But the penalty can be, it starts out at 1%, but it could go up to 5%. So it gets to be a pretty significant penalty for about 250,000 doctors, right?
Yes, and that's significant, again, in primary care, and I can speak for my family physicians. We're in the trenches, day-to-day practice that it's really small margin care. We don't have large procedures with high margins, and we have overhead to meet, but you're exactly right, and it becomes kind of a business decision, is the efforts to do that. We as an academy try to provide them tools and support to help them meet meaningful use, but even so, I'll use another example. I practice in a Mennonite community. My Mennonites don't have TVs, newspapers, or radios, so they sure don't have computers. Yeah. So that removes them from the pool.
Let me go to Dr. Adler-Milstein. We live in an era where it seems like almost everyone has a smartphone, and we imagine all of these wonderful advances that could happen with this sort of useful information. You mentioned other industries that have done a good job of dealing with data. What industries do you have in mind? I mean, who has done this, something like this, better?
Sure. Well, I think there are 2 components to it. One is if you look at industries that are sort of regularly using data to improve the value that they deliver, we look to, technology service companies, right? Amazon on a day-to-day basis is making decisions about its business strategy based on the data that they see. But that's just within Amazon. Amazon is certainly not sharing their data with their competitors, and other, organizations. So I think when we look to the data sharing piece of it, then we turn to the financial and banking industry, where you do see that there is a national system that's been created that allows you to put your ATM card into any ATM machine. Mm-hmm. I don't want to say that the 2 scenarios are equivalent. In healthcare, we're dealing with much more complex data. It is very different than the financial industry, but we can at least see that it is possible to achieve that level of information sharing of a basic set of data.
Well, you study this. You don't receive incentives for all this, so would you say that the government has not? Do you believe the penalties should be deferred until the government does a better job of enabling physicians and hospitals to use electronic healthcare data?
So I think that that's a tricky question, because on the one hand, we want to keep the pressure on to keep doctors and hospitals from demanding more from these systems. And so I think we want to keep that market demand piece there. And so if we pull the penalties back, I think there's a risk that, that we'll sort of accept the status quo and that pressure won't be there. So I think that that's a reason to think carefully about it. So if we were to pull back penalties, we need to think carefully about how to make sure that the market incentives are in place to make sure that the systems continue to improve.
Senator Warren and then Senator Cassidy.